Today I am presenting a functional outcome. A study was done at our institute. Up till many years before, the knee meniscus was thought to be a little more functionless remains of a developing leg muscles only. And then it was quickly found out that these structures were essential for preventing the onset of osteoarthritis, as well as is also essential for joint health preservation, which led to a shift in the treatment protocols, which focused more on a meniscus preservation. The goal of surgical therapy for knee injuries is to restore function by maintaining the mechanical axis and restoring the ligamentous stabilities and allowing the knee joint to function painlessly with a decent range of motion. The menisci are two fibrocartilaginous structures in the knee that are essential for proper knee function and joint preservations. They actually bear about 40 to 70% of the stress which is transferred via the knee. The menisci are also essential for maintaining the knee stability. The axial strain of tibio-femoral contact can be converted by intact menisci into hoop stresses, which preserves the knee joint. The meniscus root insertion integrity is critical for maintaining proper knee kinematics and avoiding the degenerative alternates. The rapid degeneration of the knee could occur as a result of total meniscectomy, and the meniscal root tears and avulsions are the functional equivalent of total meniscectomy. The knee ligament sprains and tears are frequently results in lateral root tears, while the pre-existing knee osteoarthritis conditions can induce medial root tears, which are more chronic in nature. When the root tears is discovered in the knee with minimal to no arthritis, the root repair is recommended. While in the case of chronic root tears caused by osteoarthritis, a conservative treatment trial is given. The meniscus damage is linked to about 50% cases of acute ACL tears, and it rises to a 90% in a chronic cases. If meniscus root tears are not treated concurrently with the cruciate ligament tears, they can aggravate the symptoms of instability, can give a negative impact on the outcomes of ACL restoration. As a result, we conducted a research to assess the functional outcome of arthroscopic meniscus root tear. We have done a prospective study with the 52 patients which were identified on MRI and clinical basis with the meniscus root tear during the period of about 2017 to 21. A follow-up was done for about 6 months, and we have included the patients with the meniscus root tears who are ready for the surgery with the operative frightening after diagnostic arthroscopy in the age group of 18 to 50 years. We excluded the patient who had already developed osteoarthritis, the medial compartment especially, and the comorbid conditions which are not fit for the surgery. The operative procedure was the standardized, the root tear was identified, and the root attachment site is prepared. The footprint for the root on the tibia was decorticated, and the transtibial meniscus root restoration technique was used. The tunnels were reamed towards the torn meniscal root attachment using an offset guide on the anterior proximal tibia, and 2 simple sutures were inserted through the torn meniscal root and down each tibial tunnel cannula. The repair was explored arthroscopically, and the knee is flexed and extended while the arthroscopic visualization is also performed. We have made sure that there should be no tension on the repaired root. The post-operative management, the limbs were kept elevated with the pillows. The intravenous antibiotic and standard management protocol was given. There will be significant stress on the meniscus, especially past 90 degree, and therefore the sutures when we have tied, it will be in the 90 degree of flexion of knee, so that the flexion can be restarted immediate post-operative. Patient was advised non-weight bearing mobilization, and 0 to 90 degree of flexion was allowed for the first 2 weeks, followed by a progressive mobilization. After 2 weeks, the flexion is increased as tolerated by the patient. Weight bearing was started after about 6 weeks. The follow-up protocol was about for the 6 months. We have used the Tegner-Lissom knee scoring system for the assessment for the clinical side of pain, swelling, and ability to climb a squares, and in Indian scenarios for the squatting. The instability, restraining support needed or limping was also assessed. In our study, we have came to a outcome of about that in 38 patients, which compromise about 73% have given excellent results, while about 23% has given a good, and 3% patients have fallen into category of poor outcome. In the present study on evaluation of based on this score, the preoperative score of 68 was found, while the Lissom knee score post-operative at 6 weeks we have noted was 81. At the end of 6 months, it was It was 92. The pain assessment at the pre-operative, the visual analog score was about average 7.46, and at the 6 months it was 1.19. In the conclusion, we found that the sports-related twisting injuries were more common in males, in young adults, and following the meniscus root repair, it is possible to get a good range of motion back post-operatively with a significant improvement in the pain as well as lifestyle activities if the appropriate post-operative physiotherapy regimen is also followed.